is our panel discussion on the personal statement for residency. A lot of you will be starting this process very soon, so we thought we'll give you an idea of what it is, what are the important things you need to be aware of. And our team reviews more than 125 personal statements and CVs every year. And Max Dibble here, who's going to talk to us about it, is our Chief Content Officer. And he'll introduce himself, and then we'll get into some of the critical aspects of the personal statement. So, Max, why don't we start with your introduction first?
Absolutely, Pawan. Thank you. My name is Max Dibble. I am a reporter, community reporter at the West Hawaii Today on the Big Island of Hawaii. I have been working as a reporter either in news or in sports for the last 5 years. Won several awards. This is something I do every single day, and have been with Pawan for a couple of years now. So we're really flowing now, and we're ready to get going and ready to help you guys do what you need to do so you can get a residency match.
All right, thank you, Max. So let's cut to the chase and discuss about the basics that everyone needs to know. So why don't we talk about the purpose of the statement? I mean, there are different specialties in residency, but let's talk about what you think should be the purpose of the statement.
Absolutely. I think the personal statements tend to be a little bit too general. Really, we're looking for, and what reviewers are going to look for, they're going to look for who you are, but specifically they want to know who you are as a doctor and who you are as a physician applying for your specific specialty. So say it's internal medicine, that's what you're looking for. That's really what your personal statement should be about. Why are you a good fit? Why have you chosen to pursue internal medicine? What qualifies you to be a part of their residency program? And that's really what your personal statement should be about. And it should be you. You should shine through. But really, most importantly, the version of you as a physician in America is the purpose of the personal statement. And we're going to talk about the content here in a little bit. But specific examples are very important when you're trying to relay this information to someone. So you don't want to say, you don't want to start off your personal statement. We're also about to talk about length here, and I guess I can jump into that right now and move back and forth.
Yep.
You're really only looking at about 650 to 800 words at the absolute most, and really 700 words is the ceiling that you're looking for. That's only about 2 pages on a Microsoft Word document, double space, 12 to 14 point font. So you don't have a lot of time. It needs to be concise, but it needs to be informative, and it needs to be unique to you. So you want your personality to shine through based on examples you give that show how qualified you are to be a resident in internal medicine or in pediatrics and so on and so forth. So that's really what you're looking for. Now, we also talk about structure. That's a little bit more fluid. I would say that the personal statement itself is really, there's an outline, there's kind of broad guidelines, but there's a lot of different ways to do it. Now, I'm a storyteller. That's how I like to communicate. And some of the personal statements that I've read, people have done that very, very well. So if you feel comfortable doing it that way, I think setting yourself up with these interviewers by putting them in a scene from your life. Maybe you start with one of the most impactful moments, the most impactful patients, or just something from your timeline that stands out to you, a moment, a scene, and that can be really powerful to bring people in. But that's not the only way to do this. If you're more of just a type A informative sort of communicator, that's fine as well too. Really what you need to do, what you need to get across in this personal statement in 700 words or less is why you've chosen this residency program, why you've chosen this specific specialty, what you can bring to this program, and examples that highlight that. So if you can do that, telling stories in moments, great. If you need to be more straightforward, you can do that as well. And I'll read your personal statement, and I'll understand within the first paragraph or two who you are as a communicator. And we will go from there. I'm going to read this over. I'm going to look at it a couple of times, and it's looked at a couple of times before I get it. So we will be very thorough, and we'll make sure that we find your voice and that you shine through in this personal statement, because that's what it's really about.
All right. Yeah. So thank you. So just to summarize, of course, length between 650, preferably 700. That's it. 700 words. If you can tell a story, that is great. You know, some impactful incident, something that catches the attention, obviously, and in terms of structure, why you have chosen one particular specialty, and what skills do you bring to the table. So great. Now let's talk about something related, which is, you know, the content. I think you've already answered some of it, but anything that we missed, you know, what exactly should be in the personal statement? Of course, it varies from person to person, but still.
Well, really, you want these specific examples. So lots of times people talk about two things. They talk about their medical skill, their expertise, you know, where they've trained, what they've learned, and what they can do. That's part of it. And then the other side of it tends to be focused on bedside manner and who you are as a person, how you interact with your patients, and that sort of thing. But you don't want to get too general here. And once again, you're fighting the length battle. So I can't really hammer it home enough. This personal statement, whether you do it in more of a storytelling format or more straightforward, it should be almost all examples. You know, it shouldn't be, you know, I grew up in this small town and, you know, my grandfather was a doctor. I mean, you can include that sort of information, but it should be, was there a time when you made a diagnosis? Was there a time when you made an observation in rounds, perhaps, that caught the attention of a doctor, you know, one of your supervisors, and they said, yeah, you know, we need to explore that more, and it led to a diagnosis, or it led to just a broader thinking, that really just to be as I guess just be as specific as you can, and if you can talk about personal interactions with people, you know, instead of saying that you really feel a connection to all your patients, put us in a moment. You know, talk about a specific patient, maybe one of your earlier ones, maybe one of the first ones that you really connected with when you were just starting to become a doctor. So that's the kind of content that we're looking for. As I mentioned before, you know, really it's who you are as a doctor, why you chose this specialty, what's going to make you successful, but you highlight it through these examples. And also, I think one thing too, it's important to emphasize why America. You know, why do you want to come to America? What about America have you experienced with? And why is this where you want to continue in your profession? And that really is where, you know, you don't need to jump into where you went to school, every single place, every single award you won. That's going to be covered in your CV. You don't need to put that all in here. But
right.
You can get specific about America. That's how I feel about it anyway, for one, and that's what I think you'd agree with that.
No, you're right. Actually, you know, why U.S. People, you know, are very generic, sometimes saying, you know, here there will be evidence-based medicine or some of the other generalities they throw out. I think even here, if it is based on the experience, on the examples, because a lot of students have actually done observerships here, they've done electives here, so they should bring that in, you know, what did they actually see, what did they actually experience, and how is it different from, in a positive sense, from their home country experience, and therefore, you know, they want to practice in the U.S. So you're right. I mean, why U.S. Tends to be very important. It's just that, like any other thing, it has to be very specific, and they should not just, you know, give the Google answer that here you have the advanced technology or, you know, the evidence-based medicine kind of answer, which a lot of them do. So yes, I completely agree.
And that was evident in almost every single one that I saw was that. And so you really do. You want to get as specific as possible. But yes, please go on, Juan, and interrupt you.
Yeah. So content-wise and structure-wise, I think it can be done in about 4 to 5 paragraphs, as we've discussed. Introduction about you. You want to introduce yourself. Not too much of detail of every high school or medical school or why you became a doctor, and then that story comes in, an impactful patient encounter or something that drove you to this field, this specialty, again, substantiating it with examples. Finally, why you are a fit, why US, again, with examples. So 650 words in about 4 to 5 paragraphs. So then I think building on this, so we spoke about the content, we spoke about the structure. Now, you touched upon, I think, some very important skills. One is the application of the medical knowledge. That's what they want to see. The other is your bedside manners or how you interact with patients, with maybe your attending. Those are some of the skills, empathy, ability to show empathy. So talk to us, in a bit of a detail about the skills that they should be showcasing in their PS.
Absolutely. Well, leadership and teamwork are the other two that would go along with medical acumen and empathy, because those are really the 4 things that you're looking at. Obviously, in a residency program, you're going to be a member of a team. You're not going to be running your own show for a while. So you need to show by example, not just say, I work really well as a member of a team. No, that's not going to play. You got to show how you work well as a member of a team, when you've worked well as a member of a team. And I think a lot of times volunteerism and things that you may have done as they relate to the medical fields or the various medical fields, that's a good way to show that, because typically you walk into a volunteer situation and a volunteer organization, you're going to be taking direction, you're going to be able to work with other people, you're going to be able to coordinate, but you also want to show leadership. And I think that leadership can even come through in those more communal settings when you're a member of a team, when you step up and show an example of when you got vocal during rounds. Show a time when you weren't concerned. I mean, we all, when we start new things, sometimes we can be a little timid, but you want to show those times when you stepped up and taking control and change the outcome of something, because that's really what you're going to be as a doctor in America. You're going to be a difference maker, and I think the reviewers, they want to see that. Also, empathy, and we did talk about that, as Juan mentioned. Really, I think you can show that just in time spent with someone, conversations had with someone, the lasting impact that perhaps you left on them or they left on you. Those things show instead of tell. I mean, that's really the first rule of writing, is show, don't tell. And it's tough in 700 words to do that. And that's why you've got to be vivid and you've got to be very specific. And finally, as Juan said, medical acumen. But once again, you don't need to list all the procedures that you learned and the different sorts of tools that you may be able to use in terms of technology and that sort of thing. That's not really. Maybe you would do that a little bit when you're talking about your time in America, maybe just a little bit to get more specific and to get away from the Google answers, as Juan said. But no, I would just, again, show a time when you showed initiative. I mean, that leadership and that medical acumen tend to go hand in hand.
Yep, excellent. All right. So finally, whether you are a storyteller or whether you cannot tell a story, whatever else, I think the most important, or one of the most important things is just the writing of the correct English, in terms of grammar, in terms of, some of these inadvertent typos that creep up. It's now the WhatsApp generation. So those things tend to be very irritating for the reviewers, and it shows that you do not have attention to detail. And the important thing here to note is that people can lose life in your profession if you don't pay attention to detail. So talk to us about, the importance of the grammar, the correct English, and why they should be careful.
Well, I think that really what you're looking at and what reviewers are going to look at, everybody knows that for the vast majority of people coming to America from other countries and other cultures, English is not going to be your first language. They're not going to expect you to be flawless. But I think, first of all the time that you put in, all the work that you put in, it makes sense to also really make the small effort, do the small thing to make sure that you get your documents looked over and that your English is correct, because they're going to see then that, one, it's important to you, two, that you're willing to take those extra few steps that are necessary, and that tells them, I think, more about you, not just as a doctor, but as a person and the kind of person that they're going to be bringing into their program, that they're going to be investing all of this time and money in. So, the grammar, it's everything. It's punctuation, it's capitalization, it's sentence structure. It's, passive versus aggressive passive versus active sentence structure. These are things that, these are things that medical students who grew up here in the States who speak English, as their first language, they're going to struggle with this kind of thing. But it's just about professionalism. It's just about showing that you care, showing that it matters to you, what that says about you as a person. And so I'm not going to run through every single little thing. I'm just going to say that no matter what, no matter how good of an English speaker you are, even if you were born here, I could run through 700 words and I could find 10 or 15 mistakes from just about anybody. So that's why I think maybe as much as anything else, the grammar and the typos, that's the kind of thing that makes this program valuable. That's the kind of thing that makes this worth the small investment for you. And like I said, we're going to go over this 2 or 3 times. I'm going to comb through all of it. I'm going to look through it once. I'm going to send it back to you, probably with some content suggestions. So you're going to make those content changes. And again, because there's going to be new sections that you've added, then there's going to be grammar and typo issues again. So I'm going to look at it at least 2, if not 3 times, and it'll be polished. And I think that's the image that you want to put forward. Polished, professional, attention to detail. That's exactly what they're going to be looking for. That's what you want to show.
All right. Very good. Thank you. Finally, rounding it up, I think the other thing we want to just caution everyone, again, it may be a cultural thing. Do not plagiarize. There are very sophisticated software tools that can just figure out, if you've copied it from Google, from somewhere on the internet, and then you are just not considered from that program. They're not going to, you may be a high scorer, you may have done whatever brilliant things. They are just not going to consider your application. So please don't plagiarize. And second thing, Max, I think, since you go through so many and you do multiple iterations, talk to us about the importance of starting early. I mean, this is not a document that anyone can write in, one day, and there's a PS. So talk to us how, in an ideal way, a student should start and, take, 1 month, 2 months, gathering stories. So talk to us a bit about some kind of a timeline that they should have.
Yeah, I think, and obviously Pawan's going to provide you with a timeline of an absolute deadline of when you need to get this in. But I think waiting too long, it comes through. It can come through as rushed, and that's obvious. And there's only so much I can do because I can't reach into your head and find the best examples. I can't reach into your head and find the best stories that you can tell. That's something that you need to think about, and it's been years, right? I mean, you've spent years getting to this point. So all of your experiences through all of it, what best exemplifies you as a doctor, you in this specific specialty? Like, why can you do this? Why is this important to you? How are you empathetic? How are you a leader? These just aren't things that you want to pull off the top of your head. So, and as Pawan said, also too, structuring it, trying to break it down, it's not going to be simple. There were a couple personal statements that were handed in that were 500 or 600 words over the limit the first time that they were done, and you put a lot of stress on yourself. You know, you're applying to these different programs. Most of you are either in school as you're filling this out, or you're working somewhere, and so you're not going to have all day. And I would suggest at least 2 to 3 weeks, if not a month or even 2, as Juan suggested. That it just makes sense, because you want to feel good about it. You want to know, okay, this is who I am. I'm on the page. These are the best examples of me. These highlight who I am the best. And you do that. You put that kind of time in. I think you're going to see the matches that come back are going to be reflective of how hard you work. And also, just to echo Juan's comments about plagiarism, he's absolutely right. Even 20 years ago, there were programs where you just take a sentence of something that someone turned into you, or a paragraph. High school teachers were doing this in America 20 years ago, just typing it into Google, and that's it, copy and pasting. If you plagiarize, you're going to get caught. And there's no need to plagiarize this, because that doesn't make any sense anyway. You're a unique individual. You have a unique story. You know, you have unique aspirations. So be unique. And obviously you can't do that if you're plagiarizing.
Yep. Thank you, Max. Thank you very much, and especially the last couple of words, which I think plagiarism is very serious. So thank you for reiterating that. All right, so very good. I think this gives a good idea of what the personal statement is, the length of the personal statement, what all should have in terms of content, importance of your life stories with specific examples, and what kind of skills you can demonstrate, or you should demonstrate. So hopefully you guys find it useful as you start writing your personal statements. And of course, as usual, if there are any other questions, you can reach out to us through our website, YouTube channel, or just WhatsApp or text. So thank you very much, Max. I appreciate your time, and that's all for tonight.
Thank you.
Thank you. Bye.